Welcome to Jenny Hughes Healing. It is Revitalizing Life Health Talk night. Let's dive right in so we can see some beautiful results that one of my practice members was generous enough to allow me to share. Share my screen. Oh, technology. There we go. Okay, this is the Revitalizing Health Talk. If you want to learn about the possibilities for increasing your health and well-being, you are in the right place. This is my practice member, Jackie. And when she came to see me, you can see the picture on the left. And 2 months later, at her 2-month assessment, which was just a little while ago, she has some really beautiful results. And what I want you to notice is that her countenance has changed. And that is very common in this type of work. In fact, even after one session, you can see a difference in somebody's face. And notice the levelness of her hands. So she had a little bit of offset in the before picture, and her hands are hanging more evenly in the now picture. And then just an overall increased symmetry. In her side photos, we can see that when she came in, she had kind of an unhealthy looking lumbar spine curvature. That's the lower back. And now it looks much healthier. Her head position is improved. It's moved back over her spine in a healthier way. And we're going to talk more about posture and why posture is important in this talk. And she let me know that she has lost 35 pounds. Amazing, just amazing. And so what is it that makes this work so powerful? What makes Elan Healing, the specific work that I do, get these kind of results? And I've boiled it down to 3 main points. Number 1 is the philosophy. We focus on what is working, which is a big change in philosophy from what we're taught. We're taught you get a symptom, you go look for a practitioner that can help you get rid of it and focus on the problem. But in healing, you actually want to focus on what is working. Talk about that. And in healing, we honor the body's ability to heal instead of trying to hit it with a lot of medications and therapies. Secondly, the neurology of light touch. Your skin has an incredible number of sensory receptors that are sensitive to movement and vibration and light touch. And these actually make it possible for you to navigate your environment, and they're important to your social interactions and your sense of touch. We utilize those to specifically tune the midbrain, which gives you an improved mind-body communication going on in your nervous system. The third is a concept that the shape, tone, and tension of your life is actually a reflection of the shape, tone, and tension of your physiology. And I know that kind of took me aback when I first heard it, and it takes some thinking, and we're going to talk about more of that as I go along. All right, so the topics I'm going to hit on tonight are the difference between healing and curing. Those terms are used interchangeably in our culture, but they're actually very different. We're going to talk about the concepts around healing facilitation. I want to cover why posture matters so much, how you can reclaim some of your vital energy, and then the benefits that you should expect from receiving healing care. Let's dive right in. Healing versus curing. All right, so curing is when you're using some type of therapy or treatment to make symptoms go away. There's a focus on the problem, and examples would be taking antibiotics or surgery to remove a clot. And by the way, I don't have any issue with what's going on. I don't have any issue with the medical system. They are actual wizards when you've got some acute infection or if you've been in an accident. Thank goodness they can do what they can do. But when it comes to chronic illness, they are not, Western medicine is not really serving us all that well. And that's where healing is coming into the picture. So healing honors that the body has a built-in intelligence and it knows how to heal itself. You all have gotten a cut on your hand or your finger and watched it heal, right? So your body can do this. A healing facilitator is a guide. You are actually the hero, where you're doing the work to facilitate your own healing, and a facilitator like me is just a guide. Healing is a journey of discovery, of making changes that allow your body to find solutions that work for you. I like this quote from Donnie Epstein that pain is an interrupter to life, so that we can find more resources and do something different, because it turns out that one of the needs of humans, what makes us feel satisfied, is to be making progress and not just staying the same. So pain is what motivates us to seek out the new answers. Now, an interesting note here, I want to say that cures can actually lead to healing, and healing can lead to cures. So let me give an example. If someone has to go in for massive like heart bypass surgery, and they have to have their chest ripped open in the process, and then after the surgery, they have been cured of the blockage or whatever they had to go into the surgery for, but also as a result, they're a more open and generous person because their chest was opened up. That is a healing that is a byproduct of the cure. And then in healing, we are not like, I am not licensed to diagnose or treat anything. And so I like to focus on what is working and to be the guide, helping a person to drop excess tension or to optimize tension, but I can't promise any cures. However, it's pretty common for symptoms to dissipate as a result of this work. All right, the basic concepts of healing facilitation is that your body has a built-in intelligence for repairing itself. So why isn't that working? Well, stress gets in the way. Stress and excess tension are really the root cause of what's getting in the way of healing. It's pretty well established that a person going into stress response, a fight or flight reaction, causes blood flow to be diverted away from the organs, out to the extremities, away from the cortex to the hindbrain. It puts us in survival mode. And so in that fight or flight mode, you're effectively shutting down your digestion, shutting down healing, and your good executive brain function is kind of minimalized. It's not a good time to make decisions. It's hard to find creativity within yourself and to connect with your intuition. So another concept in healing is that people need human touch. We need each other. And it's just tragic to me what's going on in the world right now, all of the fear and the isolation and keep 6 feet apart. That is just heartbreaking to me because we need connectedness. And I talked about this earlier, that the feeling of making progress is a basic human need. And Tony Robbins was quoted as the key to happiness is actually progress. We have a broken healthcare system. We don't have wellness care. We have illness care. Like I said before, we are culturalized. If you have a problem, go find that practitioner that is going to fix you, right? That's not working out so well for us in terms of chronic disease. Life expectancy has been dropping since 2014. And I have a reference article from CNN that you can look up. Taking the correct drug for the correct diagnosis actually kills hundreds of thousands of people per year. And this came out of the Journal of American Medical Association. It's in 1998, it was the 4th leading cause of death. This is not like highly advertised in our media environment. I wonder why. Over-the-counter medicines, we are led to believe that they're safe. Oh yeah, I'm feeling really stiff after that run. I'm going to pop a couple of Advil. Well, guess what? Things like Advil and Motrin, they are non-steroidal anti-inflammatory drugs. And what they actually do is they inhibit your platelet aggregation. That causes bleeding. They block the body chemicals that normally dilate the blood vessels leading into the kidneys. Therefore, you're decreasing the blood flow to your kidneys, and that means a lack of oxygen, and that causes kidney damage. I have a personal story, a close family member of mine who is a super intelligent PhD chemical physicist. He thought they were safe. And for 10 years, he was popping an Advil every day. And suddenly, this was a few years ago, he turned up with an egg-sized tumor attached to one of his kidneys. And that was quite a thing for him to go through, because he had to make decisions about, well, do I do the invasive surgery and have the whole kidney removed? Do we do a partial removal? Will the other kidney be able to keep up? Will I end up on dialysis for the rest of my life? This is a serious issue. So if you don't leave here with anything else, I hope it's that you'll have more of a consideration of over-the-counter medications, that they're not as safe as we're led to believe, and moderation is definitely in order. All right. Why is posture so important? So here's what happens. This graph shows that over time, we go through life and we have good times, that's the green arrow. And then we have the traumatic times. Some are small traumas, some are really big traumas. And what happens when an event happens to you that you don't quite know how to process, your brain doesn't know how to process. So especially when you're a child. So let's say you're learning to ride your bike and your dad is teaching you and you really want to impress him, but then you fall down and it really hurts, like you hurt yourself, but you don't want to disappoint your dad. So you just stuff it, right? That's what we do. We stuff it when we don't know how to deal with it, and we keep going on in our lives. Well, what happens is that over time, those little traumas build up because they load tension into your body. And that excess tension actually disrupts the optimal functioning of your nervous system. And you get a more defensive posture, like you can see in the picture. Now, what happens with this defensive posture is this is what leads to disease. And I'm going to talk more. Oh, that just popped away from me. I'm going to talk more about that later on. It's a vicious cycle where your brain is hardwired to focus on problems, and you get more of what you focus on. And so you become more defended and more defended as you go through life. Okay, so this stuffing it, we call it somaticizing it. Soma is the Latin word for body. That's why it's called somaticizing. So in terms of like a computer analogy, these are data files that are stored for processing later. And we all know what happens when your computer gets all full of old files, right? It's not working as well, needs an upgrade. It's a good short-term strategy, because if you were constantly having those traumas uploading to your cortex, you wouldn't be able to function really. But in the long term, it's causing these excess tensions to use up your vital life energy. That's where your vital life energy is being used up and holding these old files. Basically wasted on old data. So this excess tension compromises your neurological pathways. That's your brain-body communication, which helps you to heal when they're functioning properly. So a while back, a doctor had this question. He was like, okay, people are making claims that spinal misalignments are related to disease. Let's do a study to find out if that's true. So Dr. Henry Windsor at the University of Pennsylvania, he studied 97 cadavers. There were a total of 221 disease organs. And he found that there was a 99.2% correlation between misalignments of the spine and the disease states in the organs. Now, I like pictures, so let's take a look at this. The Windsor findings. With heart disease, all 20 cases that had heart conditions showed upper 5 thoracic vertebrae misaligned. So that's it. So this is your cervical spine here. Thoracic is like your upper back. And so the upper thoracic section, T1 through T5, if you follow the nerve bundles, they go straight over to your heart. And in a similar fashion, stomach disease, all 9 cases of stomach disease, those nerve bundles go over to the mid-thoracic, T5 through T9. Liver disease, 13 cases, they all go over to the mid-thoracic also. And then kidneys, all those cases, the nerve bundles went over to the misalignments were in the lower thoracic spine, which is where the nerve bundles connect into the kidneys. Pretty strong correlation. So that leads to this idea that the root cause of disease actually has to do with the spine, misalignments of the spine, and more specifically, something we call AMCT, and that stands for adverse mechanical cord tension. That is where the cord is either being stretched because of defensive posture, or it's being twisted, like you think about wringing water out of a towel. It's being twisted by vertebrae that are misaligned to each other. So the tensions in the body are what are causing these misalignments of the spine, and they put force on the spinal cord and the brainstem. I mean, probably the most significant thing of looking at this picture of someone who has their head so far forward, think about how that's stretching out the spinal cord. And if you're pulling on the spinal cord, that's actually pulling on your brainstem. It's like pulling your brain out the bottom of your skull. Yikes, right? All right, so the benefits of healing care really should be to expand the ease in the system, to dial down the sympathetic nervous system while dialing up the parasympathetic nervous system. So fight or flight is when your sympathetic nervous system fires. The parasympathetics are when you feel safe and your body can do its resting, digesting, rejuvenating. Your creativity comes back online. You have better access to your inner knowing. So in healing, we want to optimize that neurological tone in your body. So again, that idea of the shape, tone, and tension of your physiology matches the shape, tone, and tension in your life. I want you to take a moment and think of somebody who is wound pretty tight. Someone in your life that's like, oh, you know, you're around them and it's kind of feels stressful to be around them. Do they have a smooth and easy life? I'm betting that they don't. All right, the other thing that it does when we're working on optimizing reducing the adverse mechanical cord tension and optimizing the tensions in the body. You don't want no tension, right? Because then you'd be like Gumby. So the idea is really to optimize tensions. You don't want some area of the bodies being like really low tension and all spongy, and then other areas being super high tension. And so this work will increase the coordination and balance. That's handled by the cerebellum part of your brain. And then it makes your inner clarity, your inner knowing easier to access. All right, I like to do a little experiential kind of thing. So if you would take a moment to just settle in your chair and close your eyes and start gently breathing in your nose and out your mouth. I don't know about you, but I need a drink of water. It's hot today. All right, so gently breathing in your nose and out your mouth. Nothing hard. Just putting your attention on your breath. Now you're going to use your hands. This is a sensation of touch. Remember earlier, I talked about all of those sensory receptors that are in your skin. So your hands are actually magical. You can use them to help you bring breath and focus to specific areas of your body. So let's start over your eyes. You're going to gently cup your palms over your eyes, still breathing in your nose and out your mouth. And focusing on this area, just noticing, can you find some ease behind your eyes? And what I mean by ease is that it's just easy to breathe here. In fact, really great ease would be, it almost feels like, oh, life actually breathes me right here. I don't even have to work at it. Okay. Now I want you to overlap your palms. So the center of your palms are overlapping on your upper chest. And again, breathing in your nose and out your mouth. And see if you can find some ease beneath your palms. And if it does not feel easy here, in fact, it's like, oh, I don't want to be here. That is okay. It's totally normal. Just put your hands back to a place of ease. If you haven't found one yet, you can just put your hands to the side. Okay, next spot we're going to check, 2 more spots. This one is right at the base of your sternum. So that is where your rib cage comes up and meets. Again, bringing your breath and focus to the area behind your hands, breathing in your nose and out your mouth. And if it doesn't feel great here, go back to a place of ease. Remember, I talked about the philosophy of Elan healing is that we focus on what's working first. So we don't want to spend time in areas that aren't working. And the last area I will check is right over your belly button. So overlapping your palms right at your belly button. Breathing in your nose and out your mouth. Okay. Now guess what? You just took care of your spine. You paid attention to your body. You brought breath and focus to different areas. I'm guessing that you can breathe more easily because your body loves this work. And I want you to notice, because maybe you freed up some of your vital energy that was being held by some excess tension. Okay. Because Elan healing is not really in the mainstream. Most people that I talk to haven't heard of it. I do like to touch a little bit on the data because they've been collecting data on this modality for 20 years, 20 plus years, really. And it's very consistent. And it shows that in the first 2 months of care, people on average experience physical comfort in their body increasing by 14.5%. Wow, that's a lot. 14.5%. So they come in, they take a quality of life survey when they first start, and then 2 months into care, they retake the quality of life survey, and the section that deals with physical comfort in the body, which, the survey has a little over 100 questions, and the physical comfort part of it is like 10 questions. So to have the numbers go up by 14.5% is really significant. Same thing happens with mental and emotional states. They report they're improved by over 21% on average. Perceived stress levels dropping by more than 20%. Who wouldn't want their stress levels to drop by 20%? Enjoyment of life going up by more than 10%. And the quality of life ratings increase on an average of 18+%. So if you have found some kind of practitioner that is getting you results like these or better results than these, I would love to know about it, because I actually am a kind of a collector of tools that help people manage stress and release that excess tension so that they can heal. All right, we made it to the end. Let's review. We looked at some beautiful results that Jackie was so kind to let us share. We learned the difference between curing and healing. I brought your attention to maybe some safety issues around over-the-counter medications. We learned about somaticizing, how we stuff it and that ends up using your vital life energy. It also creates the defensive posture over time, which keeps your spinal cord in tension, which keeps you in a chronic state of stress and not able to heal very well. So really the goal of Elan healing is to reduce adverse mechanical cord tension, reduce the stretching, reduce the rotation on the spinal cord. It is your main communication channel, and we want it to be working at its optimum. So yeah, spine care is top priority in my eyes. And so we talked a bit about focusing on ease, this whole philosophy of focusing on what's working. And I kind of get into the law of attraction a bit. This is based in law of attraction. What you focus on expands. So it actually doesn't make sense to focus on your problems. We're hardwired to do it, so it's hard not to. But if you can develop some type of practice where you're focusing on what's working, you're focusing on finding ease in your body, that is going to expand your health and wellness. So good nutrition and exercise are important. I think most people agree on that. But spine health, I believe, is primary. All right. Does anyone have any questions? I'm going to stop the share. There we go.
No questions. However,
okay.
Excuse me. However, I really liked the illustrations of your practice member, and the difference is profound. It's really noticeable. You didn't even have to speak, and you could see, you almost didn't think it was the same person. That and the illustrations throughout that connected what you're trying to teach, made it very clear to exactly what you're explaining. So thank you.
Thank you. Thank you so much, Sharon. Okay. This is probably Oh yeah, you guys are going to be able to see the secret presenter screen. I'm not going to worry about it. All right. So I always like to end my presentations with a call to action, because when you learn something, it's not going to change your life unless you're taking some sort of action. So initial consultations with me are always complimentary. They can be done in person or over the phone. They include clarity, which is the best part. And if you schedule your consultation tonight, you will receive the physical assessment complimentary as well. That is a $75 value. That's my little incentive to get people to take action right away. And this question always comes up, so I'll just answer it. Visits for Elan Healing are $39 at this time, and they take approximately 30 minutes. All right, so I teach this class once a month. I also have a breathwork class, which goes into more detail about the experience that we did tonight of finding ease in our bodies. So I have a class that I do usually on third Thursdays of the month. This month is a little bit funky because of scheduling, so it's going to be on the fourth Thursday. But you can always find the events that I have going on my Eventbrite page. And all of that can be found through my website, jennyhugheshealing.com. That's probably the easiest thing to do. You're welcome to call me or send me a text on my cell that's on the screen. I am happy to have a conversation or answer any questions. Okay.
Thank you.
That's it. Let me stop the share. Used to that. Okay, thank you for being here.
Thank you.
Stop the recording.